The child said, I saw children with whom I was playing, just they got killed in front of my eyes. I didn't see the head of my friend with whom I was playing. Only his body was there. How could he go to heaven without his head? We spent the whole night just trying to find the bodies of people.
You seem to me to be very, very sort of calm, thoughtful. Wouldn't it be really easy to be incredibly angry?
All right, we're balanced on a kettle and premiering. Now then, in today's episode, I have a chat with Dr. Yasser Abu-Jamei. He's the Director General of the Gaza Community Mental Health Programme, which you'll hear as GCMHP in the episode. Yasser talks about the impact of the war in Gaza on the mental health of individuals and communities. He also talks about his own experience of immense loss, including in 2014 when an Israeli missile hit a building, killing 28 members of his extended family, including 19 children. We also talk about the current humanitarian blockade in Gaza, which has been ongoing for months. And he has a message about his thoughts for the international humanitarian community. I hope you find this episode insightful and share it with anybody who you think might find it valuable.
I think I better restart this talking about myself.
Yeah, that's all good, all good. So the 1 minute intro, give us what do people need to know about who you are to get a sense before we dive into the episode?
Yeah, but because I think it's a short 1 minute, so let's try to make it more interesting about the usual things that people say, Okay, I am Yasser Abu-Jamei. It's Abu-Jamei, if you say it in real Arabic. I was born in Saudi Arabia. I'm Palestinian. I returned to Gaza Strip after finishing my medical education. That was in the year 2000. I thought initially to become a pediatrician, and after doing 1 year of internship at the pediatric department, I got more interested in mental health and in psychiatry, and that was because of how the second intifada was impacting the children that I was seeing in the hospital. And from there, my journey with mental health began in the year 2002 when I joined the Gaza Community Mental Health Program first as a high diploma student. And that was a very enriching experience when I decided, okay, that's where I want to be. It's not anymore pediatrics, although it's related in one sense. And since then, I started being a student first, but then I got a very nice job employment at GCMHP as a psychiatrist. And since 2014, I became the director of the organization. GCMHP is the biggest non-governmental organization that provides mental health services in the Gaza Strip. And it's really internationally known after its pioneering mental health and human rights activist, the late Yasser Abu-Jamei, started it in 1990. So we try to follow his steps. We continue to work for the sake of helping people in Gaza Strip. But as you know and noticed that with time, things are unfortunately all the time getting worse no matter what you do. But that shouldn't really stop us from doing whatever we can do.
We're filming on the 6th of May, 2025. No food or medical supplies has entered Gaza for 9 weeks. 70% of Gaza has been seized as military buffer or civilian no-go zones by Israeli forces. How is people's mental health in Gaza right now?
I think now when we speak about mental health, the main thing now is extreme worry of the parents about their children health because of the lack of not only nutrients, because that is the case for now almost 19 months, but also any basic type of food, it's really lacking. And now many of the families, they prioritize who's going to eat today and who's not going to eat. So at best, children receive 1 meal per day, and that meal, of course, it lacks basic things like fruits, and this is really a main concern. Flour now, which is the main ingredient in our daily meals in the Middle East and in Palestine, the bread is not really almost not available, and now they have some leftovers, if you could say, some remaining little items like pasta, and they try to make bread out of pasta. You can imagine what would be that product, but at least they are simply putting something in their in their mouths in order to just not feel hungry. Now, for the mental health impact, again, this long exposure to multiple traumatic experiences, and this is not only limited to the catastrophic continuous bombardment of the population, and when children feel being frightened all the time and on the edge of just being killed at any moment, but the multiple displacements that they continue to be displaced from one area to the other area. And if we add to that they are living in a very harsh environment, when you say that almost 85%, according to some reports, of the houses, of the infrastructure is destroyed, which means that when you look around as a kid, you will just see a destroyed home, you will just see a destroyed school, you will just see everything around you that is destroyed. How can you walk around? How can you think about better day? What can you do? So these are something that now people talk, that we see that our children look numb, they are not responsive. For months now, we hear about children being a little bit aggressive, a lot of problems between children themselves, because it's like a show of rejection, we are rejecting the reality that we are living in. We are not happy about it. We are angry about it, but children show it in a very different way. And for adults, it's really interesting that now you speak about a population, 2.3 million people, half of them are children, more than 1 million children. And the adults now talking more about feeling, not only angry, not only isolated, but unfortunately they start feeling guilty, guilty because they don't have anything at hand. They cannot really help their children. They cannot even find food for their children. And this is very strange feeling that we are seeing almost for the first. Of course, we had seen many cases that adults feel guilty. Maybe I should have done this, maybe not that, etc., but not to such large extent that we are seeing now. Of course, we add this to the other usual things that we see, which is children being scared most of the time, problems with sleeping, nightmares, night terrors, bedwetting, parents having some, trauma like PTSD, but also depression, also severe anxiety, physical pains, and those physical pains are in men, women, children, adults, everyone, So it's a variety of complex issues. And of course, we talk about people who are exposed to that for more than 18 months, but also not the first time. We do not only speak about maybe the third or fourth or fifth time, but it's multiple times since the year 2008, but even earlier, because we had the second intifada, we had the first intifada, and people were all the time living under, blockade, were living under occupation. So our lives was not at all somehow peaceful. And you continue to wake from one disaster to fall into another one.
You've talked about almost the symptoms there. When you view sort of mental health challenges of people who are living in a context where it must be impossible not to have mental health challenges, how do you sort of separate what we can do to help people versus what's happening in the context? Like, it's sort of an impossible context. So could you just talk to me about how you view those two things?
This is a very important question. One of the things that we all the time see in people during emergencies and during atrocities is that they need to continue to have a sense of agency, that they are kind of doing something, That's why you see all the time men and women, they do whatever they can in order to cook something for their children. Men try to find any source of food here and there. The struggle is at the community level. It's not an individual issue. It's the whole population in Gaza Strip is going through this collectively, and that's why there is every member of the family is almost tasked with something that he or she should do. And that a little bit, masks really the psychological impact on the population, but also at the same time gives, for example, children rules that they shouldn't be doing. Kids should not be, who are like 6 or 7, shouldn't be really carrying bags of water and walking for 2 or 3 kilometers in order to provide the family with some drinking water. So this sense of agency somehow alleviates the psychological impact. And that's why when we try to meet people in the community, like, at the moment we have about almost 30 people who are visiting, and this is not a big amount of people. 30 people who are visiting the shelters, visiting the tents, trying to talk to men, women, children, help them express themselves, talk about their feelings, but also receive some counseling, receive some help with stress management, and if there are something that some serious complaints, then they refer them to our community centers. So in that cases, we ask the people what to look around and to think how they can be of help to themselves and help the people around them. And in a sense, that causes some kind of, the feeling of agency helps people move around and just think somehow positively if there is a chance for a positive thought about what to do. But also, for example, our teams take with them some toys and some stationery when these are available. And this is a big game changer, when children suddenly find that they can really express themselves through drawings, through some little play and play and talk about what problems they are facing. And they start acting out, they start really showing or talking about what are their fears when they draw like a destroyed house, when they draw some people who got wounded, and sometimes they draw blood, sometimes they draw tanks, they draw what they feel. And that makes a big difference. But again, it's a very difficult thing to do, to intervene and try to help people when the attacks are ongoing. Ideally, psychological interventions begin when the disaster is over, or when people are taken to a safe place where mental health professionals can start acting like other healthcare workers or other emergency workers, but not the situation in Gaza, unfortunately.
You talked about the sort of drawing, the process of expressing yourself. What is happening there, sort of scientifically, I guess?
We say that it's very important all the time if you have some stresses that you find someone to talk to. That's the very simple thing, And you talk usually to friends, you talk usually to members of the family, you talk to colleagues, and you discuss things. You just open your heart to someone, if you can say it. Yeah. Now, that's what we adults do, because, okay, I had a very bad dream yesterday. It was related to something. It reminded me of the house that was destroyed of my eyes. And then you talk it to someone else who could be your wife or your husband or your brother or sister or your neighboring tent, and they share with you the same experience. And then there is some sense of collective healing process, if that's able even of happening. But when it comes to children, they have different ways of expressing themselves. They are not yet mature enough to express themselves the way that we do, for example. They sometimes cannot say, we are scared, we are terrified. But you see the child, jumping from place to place, cannot stand still in one place, becomes very irritable. Girls become very shy, isolated. The children become more aggressive, Bedwetting is another, example of how trauma can express itself. So when you come to that child, and I can bring one story that one of my colleagues said. She visited the place and one camp, and people told her, go to that tent. There is a lady whose son is not talking for the last 3 or 4 days. So she went to that family, and she told the mother, well, I heard that there is a problem with one of your children. And she said, yes, well, it's not only that he haven't talked for the last 3 or 4 days, but he haven't eaten anything even. And this story about 2 or 3 months ago when food was available. So, and by the way, when we say food was available, I mean that you had something to eat. It doesn't mean that you had food really. But so the psychologist went into the tent. She sat next to the child, who was, I think, 10 years or 11 years, and she had with her like some crayons and some papers to draw on, and she just put them in the room and in the tent, and she told the child, well, I am a healthy professional. I'm here to hear you. I hear that you are not talking for a while, but I am here to listen to you. Whatever comes to your mind, just talk to me. The child didn't do anything, didn't say anything, So she waited, and then she told him again, I am here for you. After a few minutes, the child said, I saw children with whom I was playing, just they got killed in front of my eyes. And it happened, and started to cry. A little bit later, she, told him that this is, what we can do, that they want to heaven, This is something that you try to say to children just to make them a little bit calm. And, this is something everyone says. They are in heaven, they are in a better place. And comes the surprise, he said, everyone tells me like that, but I didn't see the head of my friend with whom I was playing. Only his body was there. How could he go to heaven without his head? And then she said, it's God's business. He can, Almighty, do what is needed, and of course he can connect the head with the body of that child, And then she started to calm the child a little bit. And she said, well, I heard also that you haven't eaten anything. Can I bring some food? And here are some crayons, and this bag is yours. We call it psychological first aid kit. It has some toys. It has some crayons. You can draw whatever you want. The mother was in the room. In the tent, she brought some food, piece of bread with something in it. And the child started eating. He started to not only verbalize and talk, but he started to play with the crayon and to eat. That story was brought by the psychologist, and she brought it to everyone in our community centers, and she told everyone. And when I met them in one of the meetings, she just brought this thing up. And she was extremely happy because she succeeded just to let a child speak, to make a child eat. And she spoke how happy the mother was that the child was really eating, and they followed the child 2 days later, and the child was doing okay, and they continued to provide the needed care. So sometimes these little things that you provide are very important. Sometimes you really don't feel how important they are until you see how the big change that they do. And I believe for such a child, if he hadn't really tell what he thought about how a child will be in heaven without his head, that will be a trauma that will continue with him forever. We know that exposure to trauma, once you are exposed to trauma, the trauma is still there. It's in your psyche. You cannot really erase it with a rubber. But the question is, can you go on with your life? Can you process it one way or the other? Can you overcome it and move on with your life, or it will just continue to be with you, continue to harm you, continue to impact the way you think, your capacity to concentrate, to learn new things, to go on with your life, etc., etc. And that's why many people say and talk, and this is already evidence-based, we talk about transgenerational trauma. And that's why we are too much afraid that what's going on is going to impact people for not only for ages, but for decades to go.
Yeah. The the child in that story who's the person you've spoken about, that's not an unusual story for children in Gaza. So what does the context, and you've talked about the sort of multi-generational trauma piece, but what does the context of this not being a one-off in the community, but lots of similar stories, the context of children being around death and destruction, consistently, and it's just sort of around, and you might see things like that. What does that do for the community?
Well, Dave, the numbers now is more than 60,000 people who got killed, more than 100 and I think 12,000 people who got wounded. And usually, not only this time, from even previous attacks, about 1/3 of the children, of the injured or killed are children. On the other hand, when you speak about children who lost one of their parents, you speak about 39,000 children. When you speak about, among them, there are 17,000 who lost both of their parents. They don't have parents at all. And the number of unattended children who are like the only 1% left of the family is, I think, more than 1,000 already. Children who lost one arm or leg, children with amputations, are more than 800 children. Wherever you look, these statistics are really staggering. Already half of the population before October, 2023, they were living under poverty rate. Poverty was more than 50, I think around 47%, but it reached sometimes 53%. And those children, when you speak about half of the population, children, 48% of the population, children, when you speak about 1.1 billion children who live in that small, very small geographical area. And imagine that those children haven't had education, haven't had schools now for 1.5 years. They haven't enjoyed any usual daily, just a usual 1 day of life during those 19 months. They live in tents, they walk around, destroy the places. They are psychologically impacted. They don't see any good signs for a better future at the moment. And not only that, the bombardment continue to happen almost every night, Small Gaza Strip, about 40 kilometers in length and about 8 to 12 kilometers in width. So, when bombardment happens in one city, everyone in the city hears it, So that continuous exposure to traumatic events without really a break, and at the same time that would allow some sort of healing, and at the same time living such a horrible living conditions, and at the same time being exposed to multiple displacements, and at the same time not having good, at least food, or food that will enable you will allow you to be able to stand up and just to walk around, or like just to run like children physically, just to have this kind of healthy physical well-being. It's unfortunately all of that is really impacted. Needless to speak about how the health system is now suffering, and it's basically not functioning. Vaccinations has a problem at the moment. And it's really very tough for children to just go on and just have through their daily life.
I'm just thinking about the sort of long-term trauma that we've been talking about, and I know that you have experienced immense loss in 2014. Are you able to talk to that, and just to give us a little bit about that, and what that and how that influences you on a day-to-day now in 2025?
what happened in 2014 was, how to say, the circumstances were really terrible. I mean, it was the sunset when if the building was bombed, and it was Ramadan. And that was the time when people were sitting to have their breakfast. It was around like 6 p.m., something like that, after a long day of fasting for about 14 or 13 or 14 hours. And we were hearing the adhan, which is like the call for prayer, for sunset prayer. And that's the same moment when people start eating. So we just heard at the same time the two large explosive sounds. And then we knew where was the bombing. And later on, we started to hear the news. And then we understood that the building that had, if I remember, 3 stories just leveled to the ground with more than 27 people being killed, including 3 pregnant women, including, I think, 17 children. And we spent the whole night just trying to find the bodies of people. And even when we went to the mosque the second day just to pray the funeral, let me say, prayer, or the last prayer, the burial, there was a big bag of bodies that were, not identified or not being able to separate it, like everyone else, like the parts of bodies were put together, and they were like put in one grave. So I mean, it's something that you can never really forget. It's something that you have to live with. I think I was then blessed by having so many colleagues of GSMHP around me, so many colleagues from the international community who were calling, and of course, family members, relatives from the extended family. But it was then one of the most spoken about events because of the number of people who got killed at the same hit, let me say, or attack. But look, in 2023, 24, I mean, in many attacks, hundreds of people got killed, hundreds. And if I speak about Ramadan and how that impacted the people, I mean, on the 18th of March, when the ceasefire broken by Israel, when they started attacking again, they did it at 2:30 a.m. in the morning in Ramadan day. That day, it was like just about an hour before the dawn, and people at that time were just about to wake up, or like waked up to prepare for suhoor meal, which is like the very last thing that you can eat before the sunrise, and then you stop eating, and people try to wake up and eat something. And on that specific day, on March the 18th, people were like preparing whatever food they had. Suddenly the large voices and sounds of bombardment. I don't recall the number of jet fighters that struck the Gaza Strip on that moment, but tens of jet fighters, over that small geographical area at the same time, terrifying everyone. Some of the children were still asleep, and they were waking up to that terrible event. Like any other family, some of my family members, they got killed also during the 2024, I mean, since October 2023. Smaller numbers, different circumstances, but we're like any other family in the Gaza Strip. I can't think of any family that, when you speak about, 60,000 people got killed, 10,000 under the rubble. So at least, I mean, each family have lost someone, extended family, if you could say. And one in April last year, 2 of my cousins, a little bit from the wife's, from my mother's side, they decided to go back to their house in order to bring something, to collect some clothes. The people had nothing when they fled their houses, And there were some times when they think that, okay, this moment in the day, you can still go back and try to grab something, And these two children, one was like 17, the other one was 16, who are cousins. They just decided to go back to their house in order just to get some of the things. One of them was really interested in getting his laptop because, he was, laptops for children are very important. I think they are very important for everyone. And they got inside their house that was still up. And it was in East Khan Yunis, in an area that's called Abasan. And it seems that they got into their house, they collected whatever they had to get for their parents, for their siblings. And each one had a backpack who put whatever he wants, and then decided to head back to Rafah, to the area where the tents are. And a drone killed both of them. They got both killed. And their parents couldn't just go to say goodbye to them. People who were living in a nearby school that was some sort of shelter, they decided to take the bodies and bury them. And until the moment they are buried in that school, and their parents haven't had the chance to say to them goodbye. 1 week later, another case of people from my family also got killed. Another young children, 2 boys, one was 12, one was 15. And their own mistake was that they wanted to get better internet access, and they were in a building that had internet access. The building was destroyed, bombed, and they were in the rubble for one of them for 2 hours, the other one till late evening, late night. So we went to the hospital just when the burial started. And I saw one of the fathers of those 2 kids whose bodies were in the school. And he said, "You know what, doctor? I don't know what to say, but at least they have seen the bodies of their children." Ahmed is the name of the father of the 2 children killed. At least Ahmed could saw the bodies of his both children, and he could say goodbye to them. But I couldn't, and my brother couldn't say goodbye to his son. So trauma manifested, and the way people are exposed seems to be different, but at the same time, it's pretty. The impact is so horrible, and you really have to live with those stories. You have to survive, and that's why I call everyone now who is in Gaza Strip or managed to leave Gaza Strip. He is a survivor until something, God forbid, bad happens, But speak about a survivor who spent 18 months running from one tent to the other. You speak about a survivor who for 18 months had the chance to shower only 5 or 6 times. And for women, this is extremely shameful. Speak about child who haven't had a chance of eating one type or any type of fruit for already 19 months. You talk a child who haven't seen yogurt for all his life or her life. What can we talk about? And then you have to deal what you have, and you have your colleagues who are still working, functioning, trying their best to help others, and they feel sometimes that they succeed in supporting others, but it's a very painful thing to do, and they're going through so many challenges for the time being.
Based on everything you've just said, where do you seem to me to be very, very sort of calm, thoughtful. Where does anger play into this for you? Wouldn't it be really easy to be incredibly angry?
Well, people are incredibly angry. I'm also very angry, but I think I learned over the years how to manage my anger, because I mean, you need one way or the other. Your mission is really to help others. Your mission is to lead an organization. GCMHP's vision for the last, I think, 12 years, and very similar one to it since it was began, is that GCMHP is a leading organization in the field of mental health and human rights in Palestine. In order to continue that, you need really to support your colleagues, you need to support yourself, you need to really know what to do, what to say, how to react. It's a very difficult job. It's a very challenging context, but you learn to do that. You need to learn to do that because there is no other way. I mean, we need to go to help the community. We need to help people overcome the difficult realities to, I wouldn't say cope because it's beyond coping, but at least to do something that would really allow people to go on with their lives, prevent and make the psychological impact as less as possible, if you could say that. Try to work in resilience, if there is any resilience left, help people out. And for that, you need really to control yourself, It makes things a lot worse, but that's how things are.
One of GCMHP's sort of principles, I guess, is this integration of public health and human rights. Can you just talk about the intersection of those? How do they intersect, and what are you doing in that intersection?
How can you be psychologically well when you are oppressed, when you don't really exercise or practice your basic rights, when your right to health is not there, when your right to education is not there, when your right to safety is not there, when your right to peace is not there, when your social rights are not respected, when you are on a daily basis, your basic rights are violated, when your right even to life is threatened on a daily basis, how can you survive that, So the issue is clearly linked. You cannot really live a healthy life or lead a healthy life when you are under oppression. We see it when victims of gender-based violence, of domestic violence, of people living under oppression, and etc., etc. But in Palestine, it's very unique that we speak about something that is happening for decades now. You speak about a nation that is not allowed to have its own state. We speak about people who are living in the 21st century under occupation, and this clearly impacts the daily lives of people. So these continuous violations of your rights, they will really impact the way you live, the way you think. So as mental health professionals, we deal with the implications of those violations. And some of those violations are clear. They are seen, like what happens now when people are being killed or they hear the bombardment, or sometimes when they are extremely subtle. What do I mean by subtle? I mean, for example, look at the West Bank, which is a very clear example. There are tens, if not hundreds, of checkpoints that divides the West Bank into tens of segregated areas. People who work in one city, if they go back to their home, sometimes in a nearby village, they will take hours, sometimes in order to reach their village or little town. And sometimes they will need hours to just reach their workplace. There are uncertainties about many things. Schools sometimes in the West Bank, they just close because of the terrible conditions that happen, So I mean, when you go just to collect olive from olive trees, this is a an annual suffering for the people, you know, in all the world, farmers, when it's the time to collect the production of their farms, we could say, uh, it's a cheerful moment, you know, everyone is happy, but not in Palestine. People are afraid because they can be harassed, trees could be burned to the ground, you know, etc., etc. So I mean, how can you psychologically survive such living conditions, you know?
What does resilience mean to you?
Well, in the year 2000, 2005, 2010, resilience was something like nice that I talked about, that I was proud of. That despite all the difficulties, despite all the closures, despite the blockade, despite the second intifada, despite growing in such harsh conditions, we can still go on with our lives. We have the highest number of educated people, the least number of literacy in the Middle East, the highest number per population for the master holders, for the PhD holders. Everything is against the odds, if I could say. And the title for that was said or given the title resilient, that Palestinian people are resilient. But then later on, you know, I started to question, what does that mean, you know? I mean, resilience means that despite all the stresses, you do not develop a mental disorder, you know. You continue to psychologically survive. Well, we are surviving psychologically, but we are enduring so many difficulties and stressful events and stressful times that it should stop, basically. I mean, being resilient doesn't mean that this could continue forever. Not at all. And that resilience will not be able to continue forever, you know. I mean, it shouldn't really cover the reality or overlook or make us overlook the reality that we deserve a normal human life like any other humans, you know. And we are entitled to have moments of joy, to have days of peace, and to lead a normal life. I mean, these very productive people, we the Palestinian people, deserve to continue to live like any normal people, to thrive, and to see our children play, to see our children have fun, and to move on with our lives. So the word resilience is not anywhere, it's like some sort of reminder of how many difficult days we are going through, or we already went through.
Where do you find your sources of hope amongst all of these challenges?
Well, the story that my colleague, psychologist, when she told us about her visit to the tent, and we have many of such stories, by the way, these are sources of hope. The mother of that child, when she saw her child speak again and eat again, is another story of hope, you know. The story that you see now, I don't know how many, 2.1 million people still living in Gaza Strip, and they are, despite all the difficulties, they start to go on with their lives. It's a story of hope. So I mean, the hope is present everywhere. When we had that 2 months ceasefire time, there were many groups of children, their families, started education in tents. They said, we are going to try to organize some classes. And that really worked. That's a source of hope. When you see people who say that, okay, we lost our house, but we are staying near to our home, and we are going to rebuild it again, that's a source of hope. When you see people who are just sitting on the roof of their destroyed place, and they say, here we are present, that's another sort of hope. I mean, when you see how many solidarity that is present in the international community, that's another sort of hope. When you see people who are trying to just call you to check on you, I hope everything is fine, we hope that nothing bad that is happening, that's a sort of hope. When you see a child who lost everyone in his family, but he is living with another family and he thinks, okay, I am the survivor, and he just continues to go on with his life, that's a sort of hope. Just not being broken in itself is a sort of hope. I mean, and that's what we try to do when we meet our people in the community. We just highlight how many of things around them, despite the challenges, the difficulty, are sources of hope. Our main source of hope is how miraculous our people are, and that they are standing in front of that massive killing machine, and they continue to try to go on with their lives.
I mean, that's an amazing answer. You talked in there about one of those pieces of hope being the sort of solidarity of the international community. That's the audience, leaders of international humanitarian organisations who will be watching this. So there's a few things I want to talk about along these lines. Before we get into that, just to sort of set the context for those viewers, what's a misconception? And then, there might not be one, but if there is, I'd like to ask it. What's a sort of prevalent misconception about the reality of life in Gaza that you wish you could sort of effectively dispel amongst the international community?
Well, we say, and we have seen that all the time, when the bombing is there, Gaza is on the spot. People understand what's going on. And when the bombing stops, people think that it's an end to the harsh living conditions and that people continue to live in peace, which is not the reality. Because, let's say, between 2014 and 2023, those are 9 years, the blockade on Gaza Strip with that movement constrictions were all the time present. Drones were flying in the skies all the time, reminding people of the disasters were all the time happening. At least 5 or 6 large-scale operations took place between 2014 and 2023, reminding everyone of what really happened. People with serious health illnesses were having problems just to receive health care in other areas outside Gaza Strip because of the restrictions on movement. So you continue to live under such violations of human rights, and that is not seen by the international community. People think that your life is going on. They think that it's like a disaster area, and once the war is over, recovery happens and people go on with their lives. That is never the case, unfortunately, with Gaza Strip. So this is something that needs really to change, because I think soon, in 1 month, in 2 months, in 3 months, in 1 week, another ceasefire is going to be reached. That's what I pray for. That's what I hope for. But it doesn't mean that our life will improve immediately. Mm-hmm. The immediate threats will stop. The hearing of the bombardment will stop. But our children will continue to live, not for months, but for years, within the rubble. We will not be able to rebuild the schools and the houses that were destroyed for years to come. And throughout those years, we will have triggers that will keep reminding us of the traumatic conditions, of the displacement, and of the attacks. And regardless, to speak about the people that we have lost our beloved people, our beloved colleagues, friends, family members who got killed during the attacks.
For international development sort of professionals, leaders of organisations who are listening to this or watching it, who are sort of seeking to make a meaningful difference in the lives of people in Gaza right now, what should they be doing? What are the advocacy things they should be doing? What are the program things they should be doing? What are the funding things they should be doing? What should international leaders of non-profit organisations, humanitarian organisations, what should they be doing to sort of make a meaningful impact in helping?
Well, I mean, in every place where war takes place, there are some rules and regulations that need to be followed. For example, the right to health, evacuation of the people who got wounded or killed hospital, how to say, safety to healthcare workers, allow food in, allow water in, these basic things, allow things that are needed for women and children, hygiene things, I mean, these very basic things are never respected, and they were never respected during those 18 or 19 months. I mean, rules are for everyone, and they should be respected in every place. And Palestinian people are not exception from that. And it's not really acceptable that the leaders of the international community are just watching and they are just talking. I mean, they don't do anything besides just making an announcement or making a statement or sending a report, and nothing else happens. I mean, is this how things should be? It's really beyond understanding, beyond the imagination, really. I mean, they need really to be proactive. They need to take decisions, and they need to strengthen their lobbying and advocacy, and they need to take on-the-ground actions. Food, very basic thing, medications should really not be stopped from getting inside Gaza Strip. Very simple, very basic thing, And if they fail to do that, sorry, then why we need them? I mean, what's the need for the international community, for the NGO workers, for the... if you can't really manage to, for 2 months now, to get flour or get milk into Gaza Strip, what's the use of your presence? I mean, it's really a big question mark,
I mean, how would you answer that?
Well, I think they should challenge the conditions,
Mm-hmm.
So if Israel says we stop allowing food in, someone should say that's not going to happen. We are going to continue sending food trucks inside Gaza Strip. And trucks are standing on the borders now for 2 months and even earlier than that. These trucks should not have ever stopped. Food should never have stopped. Material that is needed for hospitals, for surgeries, should not have stopped. We have seen children and adults alike who were operated without anesthetics. Some of them got their legs amputated and hands amputated without the use of anesthetics, Many of the people who received simple intervention and they had serious ones, they got contaminated and they got really serious complications that ended with their ones, like with arms or legs or hands being amputated, or they just got killed. And I think no one is above the law. No one should be above the international law, no matter who he or she is. And that applies to governments, that applies to countries. We deserve something better. Our future should be better than our past. Our children should have a better life. Our children, or the children of any place of the world, should have not or had not endured such terrible conditions, and they should not be exposed to those conditions in the future. The international community should not only stop the current atrocities, but they should not allow it to happen again. And what we Palestinians are looking for are our basic rights, our basic human rights that allow us to thrive and to enjoy healthy psychological, mental health well-being like any other people on this planet.